everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Diphenhydramine. Its brand name is Benadryl. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Diphenhydramine acts as an antihistamine by competing with histamine at receptor sites on effector cells. Some, but not all, indications for use would include the treatment of allergic conjunctivitis, the treatment of acute, uncomplicated allergic reactions. It can be used to treat skin manifestations of urticaria or angioedema. Allergic rhinitis and the common cold can be treated with diphenhydramine or Benadryl. Some patients use Benadryl for insomnia or motion sickness. And finally, it can be used to treat itchiness of the skin. Before somebody was to use Benadryl, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If somebody has a hypersensitivity to diphenhydramine or similar antihistamines, they would not be able to use this medication. Newborns or premature infants cannot use diphenhydramine or Benadryl. Medication cannot be used by nursing mothers. And finally, it cannot be used as a local anesthetic. Now, in terms of precautions, diphenhydramine is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. We would want to avoid it in the elderly population due to their decrease in clearance, which could lead to an increase in anticholinergic side effects and toxicity. We would want to use this medication cautiously in patients who have cardiovascular disease or hypertension, also known as high blood pressure. Patients should be made aware that they should avoid alcohol with the use of Benadryl. They should also avoid other medications that include diphenhydramine in their formulation. Patients should avoid using diphenhydramine with other medications that cause sedation. Local necrosis may occur if somebody was to use the IV or IM formulation subcutaneously. This medication should be used cautiously in patients who have hypothyroidism. It should also be used cautiously in patients who have stenosing peptic ulcers, as well as pyloroduodenal obstruction. Patients should be made aware that impaired mental alertness or drowsiness may occur with the use of this medication. It should be used cautiously in patients who have glaucoma, especially narrow angle closure glaucoma. Overdose in pediatric patients may result in hallucinations, as well as convulsions. It should be used cautiously in patients who have bladder neck obstruction. It should also be used cautiously in patients who have symptomatic prostatic hypertrophy. Patients with bronchial asthma or lower respiratory diseases should use this medication cautiously. Patients, especially young patients, should be made aware that excitation may occur. And finally, there's an increased risk of sedation, dizziness, and hypotension in patients greater than 60 years old who use this medication. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Benadryl, they can expect to receive their dose orally, intravenously, or intramuscularly. If somebody is treating allergic conjunctivitis with oral Benadryl, they can take 25 to 50 milligrams 3 or 4 times daily. Skin manifestations of urticaria or angioedema, if they're uncomplicated, would be treated in the same way, 25 or 50 milligrams 3 to 4 times daily. Patients can use 25 or 50 milligrams every 4 to 6 hours when treating the common cold, and the maximum dose in this situation would be 300 milligrams daily. 50 milligrams at bedtime is sometimes used to treat insomnia. If somebody is using the injectable solution to treat motion sickness, they may use 10 to 50 milligrams intravenously or intramuscularly. Doses of 100 milligrams may be used if necessary. The maximum dose in this situation would be 400 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Benadryl, so I'll go over some of those here now. Dizziness, sedation, and dyskinesias have been reported. Some patients experience somnolence. Other patients may experience dry nasal mucosa, laryngeal dryness, as well as thick sputum. One serious side effect to Benadryl would be anaphylaxis. That's all we're going to talk about today with diphenhydramine or Benadryl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.